Hello, this is Dr. Dale again. This video is on alphabetic list problem, still on letter F. Today I'm going to talk about the fibromyalgia. I think I had a previous video on the, if you follow the quarantine special edition, I talked about the fibromyalgia and the PMR, which is polymyalgia rheumatica. It's kind of comparison, but today I'm just going to spend the whole video talk about the fibromyalgia. What is this fibromyalgia? Is there any associated condition? Need to see the emergency? Probably not, because this fibromyalgia is just a chronic pain uncertainty. I call it pain of uncertainty. What does it mean? Is the pain is migrating from one place to another place. Usually it occurred in young female. Without any abnormal laboratory findings, without any organic disease, pathological disease, but just the pain. The pain usually is near the joint. It's not the joint pain, it's near the joint. And the pain is, the mechanism for this fibromyalgia, it's not sure. It's associated with the trigger point pain. And there's many theories. Could be psychological cause, or could be the really caused by the gamma neuron theory. It said the gamma neuron is a special muscle fibers, has the function of nerve. The nerve function is a special structured fibers associated with the nerves and at the end of a tendon, which is the end of the muscles. So there's tendon ligament. Probably know the ligament is the fibrous structures connect to the bones, and the ligament usually is in the joint. If you have ligament undergoing inflammation, you feel the joint pain. But this is a tendon, which is the end of a muscle attached to the bone. So there, at the end of this junction of the tendon and the muscle, there's a special gamma neuron, which is it's a gamma unit or gamma neuron. It's a specialized muscle fiber and has a nerve function to detect the muscle strength, to detect the muscle length, maintain the muscle, especially for the muscles that are associated with maintaining the position. So this is one of the theory. It could be this kind of special muscle fibers or neurons undergoing the constantly irritation, so that causes the pain. Usually the pain is located in near the joint, for the elbow or the pelvic or the neck, the shoulder, frontal back, or the frontal back, the pelvic region, the iliacs or the ischial bones. So these are, and also around the ankle, but it's not the joint pain. The other important characteristic for this fibromyalgia is that it occurs in young female. It's associated with psychological disease, for example, anxiety, insomnia, depression. These are all associated with physical pain, but without really abnormal laboratory findings. So there's another migration or migrating pain, like or the pain of uncertainty, like for example, the connective tissue disease, rheumatoid arthritis. Feel the joint here, there, here. It's a joint pain. It's associated with the small joints in the body, and it's really the tendon, the ligaments, and the tissues among the joint. So, and the true inflammation disease, because there is abnormal laboratory findings, either X-ray or the blood anti-rheumatoid, for example, rheumatoid arthritis factor or the anti-nuclear antibody. So these are the true joint disease, connective tissue disease, with the association of the abnormal laboratory findings. But this fibromyalgia do not have any of those. Just feel the pain. The pain is there, and it decreases the function level, decreases the quality of life, and bothers. And the pain may be triggered by other psychological conditions, like I said, depression, anxiety, or the insomnia, long-term deprived of sleep. And feel physically fatigued and tired because of this constant pain. It is a disease, but it's just the disease without objective findings or without objective laboratory abnormalities. So why I mentioned about comparison of this fibromyalgia with polymyalgia rheumatica, that video I mentioned about the difference between these two diseases. I'm going to mention again. The PMR, polymyalgia rheumatica, is usually occur in the older female and with the abnormal laboratory findings, which is the erythrocyte sediment rate, ESR, or C-reactive protein. These two measures, the laboratory abnormalities, is not specific. It's for a variety of inflammation disease. Any kind of inflammatory disease can cause this abnormal laboratory findings. So for this PMR, polymyalgia rheumatica, had this kind of findings, and it is in older people associated with the arthritis, especially temporal arthritis, called giant cell arthritis, which has a risk for the vision impairment. So this is the difference. They all occur usually in female. One is in older, one is in younger, and the other one really had the organic disease and abnormal laboratory findings and need to be treated with the steroid. So the PMR, polymyalgia rheumatica, has to be treated by the steroid. The sooner the better, to really anti-inflammation. Could be caused by the autoimmune, could be caused by the virus infection, triggered immune response. But this fibromyalgia, on the other hand, is not treated by the steroid. Does not help. However, the antidepressant or anti-anxiety medication, or the medication will promote sleeping, this kind of medication can treat the fibromyalgia. At the same time, the trigger point injection, the local injection with the anti-inflammation or the pain medication can improve the symptoms, improve the quality of life, improve the sleeping quality, and also to affiliate with improve the psychological function. See, the psychological disease like depression, anxiety, or insomnia can make this fibromyalgia worse. At the same time, the fibromyalgia, the generalized aching pain, also can trigger the depression, anxiety, and sleeping disorder. So this is integrated, but it is a pain, it is a disease, just without abnormal laboratory findings, without any X-ray abnormalities, it's not occurring in the joint, but it's near joint. So this is a group, especially in young or middle-aged female, and sometimes it can be mixed or considered as other pathological disease, mimic other pathological disease. For example, hypothyroidism is one, or anemia is another one, or any other conditions or psychological disease can be confused with this fibromyalgia. But the treatment, the antidepressant or anti-anxiety medication or the trigger point injection can treat this, can improve the symptom. So this, so if you're a young female or either middle-aged female, if you undergoing this kind of, couldn't tell it's a depression or it's just generalized aching, lack of energy, go get a check out and to exclude true psychological or pathological disease. Then if it is the fibromyalgia, then treat either trigger point injection or give some anti-psychological or any other medications can improve the symptoms, can improve the quality of life. So this is about the video. I spent the whole video talk about the fibromyalgia because it's quite common. So I'm going to stop here and hope it helps and to give you some idea if you have this kind of generalized aching, not sure it's depression or deprived or insomnia or just the fibromyalgia. Go get it checked and get diagnosed and get treated. So I'm going to stop here. Thank you for watching. I will see you next time.